my name is Jackie Luna, and I am here to talk to you about the importance of culturally competent diabetes care, especially for Latinos. So, how many of you have ever had to go with your parents to all of their doctor's appointments to help them understand anything? I know I have. Before I even knew what diabetes was or its implications, I was having to explain it to my parents. This is why it is important for doctors to be culturally competent and patient. You're probably asking yourself what cultural competence is. Essentially, it is appreciating and respecting cultural differences and taking them into consideration in order to care for patients. For myself, and probably you too, this could be seen with a doctor delivering diabetes care instructions in a way that makes sense to our parents instead of just listing the medicines and letting them be. Latinos make up about 17% of the U.S. population, and diabetes affects 11.8% of us. Culturally competent healthcare is important because disparities exist among Latinos. We are generally less wealthy, generally have more health problems, and if your parents are anything like mine, we don't like going to the doctors. Current guidelines for diabetes type 2 care and management emphasize healthy lifestyles and behavioral changes. However, this traditional treatment is not enough to help Latinos manage their diabetes. This is because of communication barriers within patients to providers, lack of language proficiency, and lack of providers' cultural competency in communication. In order to better support Latino diabetes education, community healthcare workers have arisen. They are well-trained bilingual educators who better understand how we can improve diabetes care and outcomes among ourselves. This is supported by the Diabetes Prevention in Hispanics report from a randomized controlled trial. The study was done from 2008 to 2012. It included Hispanic men and women 18 years and older. It implemented a lifestyle intervention program known as the Diabetes Prevention Program, or DPP. It was done in 5 guided educational sessions in patients' homes. It demonstrated that a behavioral lifestyle intervention with community health workers to lose weight and increase physical activity reduced the development of diabetes by a whopping 58% during this 3-year period. Community health workers understand patients better than the doctors. Essentially, this is because they are from the same cultural background. The diabetes prevention program from the study mentioned also resulted in significant reduction in mean levels of the HbA1c, which is just a fancy way of saying blood sugar, and the prevention of diabetes. My mom has actually participated in these educational workshops with community health workers in our community, and she went from being labeled pre-diabetic to not at all, which is awesome, and it also put a lot of stress off me from having to explain everything to her, and now I can better educate myself as to what diabetes is and then help her and give back to her and the community. With the incidence of diabetes occurring at such a high rate and Latinos growing at such a fast rate, it is imperative to have community health workers serve as that bridge between physicians and patients. Be your own advocate. If you're a child of someone with diabetes or have diabetes yourself, and you're having trouble just really understanding a doctor, you can ask for programs that use community health workers in order to better help your parents or yourself. And remember, you are not alone.